to CNS Viewpoint. Friends, as every day at 5 p.m. India time, we connect with you, we share our thoughts and views and perspectives on things that made us think. And we're talking about the data today, which was just been released by the government of India, that a very significant part of our population who got first dose in different age brackets um, have not yet taken their second dose, have not got their second dose, let's say that, because we don't know the reason why they have not got their second dose. Um, was it because of vaccine shortage? Was it because of hesitancy? Was it because of side effects? Was it because of there was no record, or there was some problems with the record keeping? Was it because of the follow-up? Or we don't know the reasons. There could be a myriad of reasons. So let's say they have the people who have got first dose in the country have a lot of them, a significant number of them, a really significant number of them have not got their second dose. And let us talk about even among those who were the top priority populations to get the vaccine shots for COVID-19, for instance, those who were above 60 years of age, or those who were frontline healthcare workers or other frontline workers who were identified as the first top priority to get the COVID vaccine shots when the vaccine rollout began on 16 January 2021. Even if you look at those numbers, a lot of them have not got their second shot or have not yet received their second shot. Now that is a very alarming thing, because the goal, it's almost a year, it's almost like 10, 11 months since the vaccination began in the country, and time is running out. If you look at richer nations, they are administering over a million doses of booster vaccines to people who were vaccinated early on in January or February, March, April, May, June. Basically 6 months. After 6 months of full vaccination, people are becoming eligible in countries like UK for a second booster shot, despite World Health Organization saying that there is a global moratorium on booster doses. So people should not be administering booster doses till end of this year. This is what WHO Dr. Tedros, Director General Dr. Tedros, had repeatedly been saying since months, but ignoring that, many countries have gone ahead with booster dose rollout. So coming back to second dose, because this is very important, people need to be fully protected, fully vaccinated. It's not just about number of doses administered. It is about how much of population is fully vaccinated within a certain period of time, so that a significant part of that population who are fully vaccinated are less at risk of serious outcomes and death in an event if corona wave comes, if they get infected with coronavirus and corona has not gone out. There are almost 10 to 20,000 new cases in India, and 300 or 400 deaths or 500 plus deaths every day. It has not gone out. If you look at daily numbers, it is a very alarming number of cases that happen every single day, and a very alarming number of deaths that are occurring every single day. I know it is very less than compared to the peak, but even this is not zero. It has not gone out of our population. It is still circulating in the population while we are relaxing, which is okay. But we have to ensure that social and public health measures and not lockdown are in place as well while we are rolling out these the vaccination. So coming back to second dose vaccination, it is really very important. So let us look at the numbers which were released, which we could learn. So in 60 years age group in the country, above 60 years, the first dose was administered to about almost like 11.04 crores. But only 60% or so of them, 6.78 crores, got the second dose. If you look at other population, other age groups, so for instance, at 18 to 44 years age group, first dose was administered to 42.33 crores, or 420 million people who got the first dose. But second dose was only administered to 14.89 crores. Out of 42.33, only 14.89 crores got their second dose. 420 million got first dose and 140 million got second dose. This is like one third. So two-thirds did not get their second dose. Out of 45 to 59 years age group people, the first dose was administered to 17.60 crores or 176 million, and second dose was administered to 9.85 crores. So 17.60 crores got first dose in 45 to 59 age group, 17.60 crores first dose, and second dose was administered to 9.85 crores. Almost half. So likewise, if you look at other people who got top priority in vaccination, like healthcare workers, 1.03 crores got the first dose, and out of that 0.92 crores have got the second dose. And frontline workers, first dose 1.83 crores and 1.60 crores got the second dose. So that is a lot of people. For instance, if you look at frontline workers, there are almost more than 2.3 million people who have not yet got their second dose. If you look at healthcare workers, almost 1 million healthcare workers have not got their second dose. If you look at 45-59, almost 10 million people or 8-9 million people have not got their second dose. If you look at 18 to 44 age group, oh God, that is a very large number. It is almost like 300 million. 300 million, almost 300 million or less than 300 million people have not got their second dose. And if you look at 60 years, then almost like 40 to 50 million people have not yet got their second dose. There's a lot of work ahead of us to ensure that people have got the first dose early on in January, February, March, very early on, because this was a top priority. These were the top priority populations. They should get their second dose. The second dose should reach them. What about accountability? What about the government promise to ensure that those who are senior citizens, those who have restricted mobility, or persons with disabilities, they will get the vaccination on their doorstep? What about that? And if you look at other disease programs like tuberculosis, apart from Kerala in India, a southern state, some districts of Kerala, where there was zero default rate for tuberculosis, I don't think we have really fared very badly, because people do default, which means that they do drop out of the program, and program is not able to 100% bring them back to the program, which is really a possible area for a lot of improvement. Basically, we can't, if a person starts getting TB care from a government center, and if there should not be any dropping out, we need to ensure and address those reasons which are blocking access to care. So coming back to COVID-19, it is really important for people to be fully vaccinated within a certain period of time, so that their vaccine protection levels are optimal, maximal. Also, the World Health Organization and countries need to come out very clearly, be on the same page regarding booster dose. Do we need it? Do we not? And of course, the inequity is not acceptable when 0.4% of the total vaccines which have been administered in the world, only 0.4% of those vaccines have been given in the low-income countries. This is just not acceptable. This kind of inequity, where over 1 million vaccines, booster doses are being administered in rich nations, only 330,000 vaccine doses are administered in the low-income countries. Or in other words, more booster doses are given in United Kingdom every day than the number of people in Africa, the whole of African continent, who get the first dose. This is the disparity. This is the stark inequality we are dealing with. In moments of crisis, a global public health crisis which has impacted each and every one of us on the planet, just like climate crisis. So we really need a more equitable response. There is no escaping out. So with these words, I will conclude today's CNS Viewpoint, and with the hope that everyone is fully vaccinated within a certain period of time, everywhere on the planet Earth, because that is what we need to have the best hope for decimating COVID-19. So with this hope and with these words, bye bye, stay safe, get yourself vaccinated. Whether you are vaccinated or not, please wear a mask, wear it properly, correctly, maintain social distancing or physical distancing, all social and public health measures, not lockdown, and other protocols which are in place to fight COVID-19. Take care of yourself. See you tomorrow, 5 p.m. India time, again with something which made us think tomorrow. Bye bye. Stay safe.